Okay, good afternoon, everybody. Thank you for waiting. I'm proud to be joined by Senators Murray and Booker. Well, here we are on day 15 of the Trump shutdown. That's right, it's now over 2 weeks since Republicans shut the government down because they refused to negotiate and fix the health care crisis that they themselves created. In fact, House Republicans haven't been here doing their job in weeks. Thousands of federal workers continue to work and not get paid. House Republicans continue to get paid and don't work. Meanwhile, open enrollment starts in 2 weeks. Americans will have to choose plans that send this cost skyrocketing. As we speak, right as we speak, families are getting letters for their new health insurance rates. This is in my home state of New York. It happens to coincidentally be in Stefanik's district. Look at the change. This is a bronze plan on Excelis, which is one of our big insurers. $282 a month. That's a lot for a family, a working family. But look what it goes up to if we don't renew the credits. $1,679. That's close to $1,400 a month. That's like $16,000 a year. Just imagine. Millions of New Yorkers are going to get these notices. Tens of millions of Americans are going to get these notices. And they're just going to say to themselves, what? How am I going to pay this? But you know what the alternative is? Having no health care. And imagine parents thinking, what if my kid gets sick? And there's no health care for them because I can't afford insurance and I can't afford the cost out of my pocket. So these are not just numbers. These are people who are suffering and going to suffer even more. So we have to do something. And right now, Republicans are letting these tax credits expire. Republicans, Donald Trump, Republicans, House and Senate are responsible for this number going up, including Representative Stefanik. So, for the average family or small business owner or farmer in rural upstate New York, spending over $20,000 a year on health care is unfathomable. And nationwide, it's true. Guess what district? Does anyone know? I'm not going to ask you to raise your hands, but does anyone know what district hurts more than any out of any state in the country? Speaker Johnson's. So it shows how much he cares about his constituents. According to a recent report, 85,000 Louisiana residents will lose health insurance. So it's just unfathomable as why Republicans are hiding from this issue that would so hurt American families. Republican policies have skyrocketed costs to historic highs on everything, from beef to electricity costs. Costs is the #1 issue facing American people. How they're going to pay each week their bills. And because of Trump's tariffs, because of what they did on electric rates, because food costs are going up so much, and health care is the tip of the spear of that cost increase. And yet, Republicans are not moving forward. People get sick. People will lose their insurance. People will die. Plain and simple. Republicans know this, and yet neither Trump nor congressional Republicans are even trying to solve the health care crisis. And that is just a horror for the American people. Now on Argentina. Donald Trump's busy trying to deliver $40 billion to bail out Argentina. It's the new Trump doctrine of foreign policy. Argentina first. Rather than fix the health care crisis devastating Americans here at home, Trump's doubling down on sending $40 billion to a right-wing MAGA strongman in Argentina. Now he's trying to pressure American banks to pony up, on top of the $20 billion in taxpayer money that he's sending there. This shows the administration's priorities. They'd rather give $40 billion to a MAGA dictator than help relieve Americans from the health care crisis they are suffering from. Whatever happened to America first? Donald Trump? Whatever happened to America first? It's time for Republicans to end the chaos and get serious, and we are doing everything we can to make that happen. Now, about the rifts. Every day the Republican chaos seems to get worse. They seem to double chaos almost on a daily basis, and nowhere is this clearer than at HHS. Trump and Vogt managed to do something truly astonishing. They, quote, accidentally fired twice as many public health workers as intended. It's vicious, it's mean, and it's incompetence, all wrapped up in one. Let me say that again. They meant to fire hundreds of people, but they were so careless they accidentally fired hundreds more. They chose to vindictively fire thousands of federal workers and couldn't even do that right. No one is forcing Trump to fire scientists or doctors in the middle of the season. They're doing it because they want to. The goal of Project 2025, a vote, and it seems Trump, is to just decimate the federal government no matter how it hurts the workers and no matter how it hurts the American people. They're gutting America's public health defenses because they want to. And don't take my word for it. Senator Lee said, quote, Russ Vought has been dreaming of this moment ever since puberty. Republicans need to get serious. They need to negotiate. We are ready to negotiate, reopen the government, and deliver desperately needed health care to the American people. Senator Murray, and my pen.
You know, for weeks we have been hearing a lot of heartbreaking stories from folks back home in my home state of Washington, families who are absolutely panicking about their premiums that are doubling. There's small business owners who are having to think about abandoning the job they love to get employer-sponsored health care elsewhere, or just foregoing coverage altogether. But today I actually want to talk about our neighbors, Idaho, because today is the first day of open enrollment in Idaho, which means today, right now, families are getting their first real look at the cost of Republicans' inaction on health care. Republicans don't seem very eager to talk about that, but there is no running from the fact that these hikes are going to crush people. That's why last week I actually held a call with people in Idaho who are watching their health care costs go through the roof, and here's what I heard. One retiree who's not old enough yet to be on Medicare told me about how her premiums are going to jump by 173%, almost triple. You think that's bad? Another Idahoan I spoke with had learned that with the tax credits, his premium will be $367 a month. Without those tax credits, a whopping $2,232 a month. But Bob and Susan are far from alone. There are more than 100,000 people in Idaho who rely on the ACA tax credits to help them afford their health care coverage. Today, those families will log on to shop for a health plan and feel their heart drop as they see these prices have skyrocketed. They're wondering if they can even afford health care now. It is terrifying, and it's happening right now in Idaho. And it's coming to states across the country in 2 weeks. Several other states have already opened their window shopping for these health plans. People in my state have already gotten notices about premiums doubling, and yet all the while Republican leaders are trying to stick their heads in the sand and trying to pretend that everything is fine. On one hand, we have many Republicans saying, what's the rush? We can talk about maybe doing something on health care later. Never mind the fact that they refused to talk about this earlier, even as they rushed to jam through tax breaks for billionaires a few months ago. And on the other hand, we have some Republicans who are basically saying they don't want to do anything. In fact, some Republicans still wish they could repeal the Affordable Care Act. How detached from reality can Republicans get? It is bad enough so many of them can see the iceberg coming and are saying, we'll worry about that after the ship goes down. But we've also got Republicans saying, bet you wish this ship had sunk earlier. Some Republicans are all but cheering for these higher premiums. Republicans may have chosen to shut down the government rather than address this health care, but Idaho just opened up enrollment, and the rest of the nation is around the bend. President Trump and Republican leadership may try to bury their heads in the sand, but they are not going to be able to bury the headline here. Healthcare premiums are doubling, tripling, and even in some places quadrupling. Families do not have the luxury of ignoring health care. But instead of putting a single penny forward to help people afford health care, Donald Trump is giving $20 billion taxpayer money to Argentina in a bailout. What happened to America first? So the bottom line has not changed. When Republicans are ready to get serious, Democrats will be at the negotiating table where we have been for weeks, ready to reach a bipartisan deal that opens up the government and addresses this health care crisis. Thank you.
So this is a really terrifying time, and I know that people down here in Washington, I think, make a mistake when they think this is about politics. It's about people. When people think this is about Washington as usual, this is about working people and what is, frankly, outrageous in the terms of what it's going to do to their lives. Down in these marble halls, we are not talking to Americans right now, but when I go home to my state, I see so many people who are facing what is for their families a moment of deep crisis. When I come to Washington, I hear about how many days, counting the days of a government shutdown. Well, families all across America right now are counting the days before they know the staggeringly devastating thing is going to happen, which is going to be their health care costs doubling and tripling. I've sat down with small business people as thousands upon thousands of small businesses all across the country get their health insurance through the exchanges, who tell me very plainly they cannot afford to keep health insurance for them or their few employees if the rates skyrocket again in just a matter of weeks. I talk to moms who have special needs kids who are in this state of panic that if their health care costs go up, it will devastate their family and their ability to sustain care. We are in the midst of a health care crisis, the likes of which we have never seen before in the history of our country. Literally, 2026 is going to be the year, if we do nothing, that the most people in American history lose their health coverage between what the Republicans have already done to Medicaid and what's going to happen with the ACA in the beginning of the year. I cannot tell you how outraged I am that we here in Washington are having a fight over a budget where our Republican colleagues are not even willing to sit at the table right now and negotiate a way to help Americans in their time of crisis. And what frustrates me about this is it's not that hard to do something about it. I've watched over the last 10 months as Republicans have seemed to be able to find the money for so many other of their priorities, whether it's the explosion in hiring they're doing in ICE as we see the work going on in cities from coast to coast, whether it's finding the money to give billionaires the biggest tax cut, corporations, big tax cut. They seem to find the money for anything, and we're hearing now that the president is trying to bail out one of his friends with $20 million of taxpayer money. We can come up with money for those things, but not for struggling families, struggling small businesses, without the people who are struggling in our states, who are watching the clock tick closer and closer to the point where they can't afford their insurance. Budgets are reflections of our values, and we're standing up for what I think is the greatest of all American values, is that we stand for each other. Now, I believe, unfortunately, this is part of a plan. It's very clear to me There's an old saying, don't listen to what I say, watch what I do. Well, we have seen Republicans over the years do everything they can to gut and cut or end the Affordable Care Act. We watched them take dozens and dozens of votes in Donald Trump's first term to try to end the Affordable Care Act. And then they told us what they wanted to do should they gain power as they have in the White House, the Senate, and the House of Representatives. They literally spelled it out in Project 2025 that they wanted to gut, cut, and end the Affordable Care Act. And so here we are, watching their plan to take health care away from millions and millions of Americans. And so we say no. This is not about politics for us, it's about people. It's not about business as usual in Washington. It's about fighting something that's deeply unusual in Americans, where people in this body turn their back on Americans in their greatest state of crisis, because losing your health care, as millions will, if we do nothing now, is an existential crisis for so many American families. Where do you stand? Where do you stand when it comes for health care, to health care for American people? Well, I know where Democrats stand, and I'm proud to be standing for people's health care. I'm proud to be standing to defend against what Republicans seem intent to do, which is to end the Affordable Care Act, or at least gut it so that it's out of reach for millions of Americans. Thank you.
Glory.
Leader Schumer.
Yes, go ahead.
Mr. Leader, the Republicans have signaled that they're going to put a defense appropriations bill on the floor tomorrow morning. That would be going through the regular appropriations process. Will Democrats support that defense bill?
We have to see what they're going to put on the floor. They haven't told us yet. Yes. No. Right here.
Thank you, Mr. Leader. Can you just talk to us about your comments last week in an interview where you said every day gets better for us, because Republicans have seized on that. So can you explain what you meant?
Look, every day more and more Americans see how bad this health crisis is as they get their notices, as they hear all about it, and every day they are seeing more and more that Democrats are on their side fighting for what they believe in. Yes.
Thank you. Early voting in New York begins in 10 days. When are we going to see an endorsement on your party's candidate?
As I said, we've had several good conversations. We've worked together in the past, and the conversations will continue. Yes, Chad.
Thank you. There's a town hall meeting tonight on CNN with Alexandria Ocasio-Cortez and Bernie Sanders about the government shutdown. Is it a concern to you that the progressives and the left wing get so much attention sometimes compared to moderates, and does that distort the Democrats' message?
We're fighting on the same side. We all believe that there's a health care crisis, and we all believe that we have to address that with the American people. Go ahead, Manu.
Republicans have rejected all of your demands so far, so isn't it incumbent upon you to compromise, move a little bit closer to their position, scale back your demands? Shouldn't you show a little give here?
The bottom line is they won't even negotiate with us, so that's a premature question. But of course, I'm not going to negotiate in public. We need to address the crisis that is afflicting, and that's the right word, the American people. Last one.
Even if your health care demands are met, would it be enough for you to support a government funding bill if the White House decisions continue, or is that a red line for you?
Look, I'm not going to negotiate in public. You know the things that we are asking for. Thank you.